All right, let's dive right in. Welcome to today's Explainer. We're tackling something today that is, well, universally feared and honestly, wildly misunderstood: lower back pain. More specifically, we're putting the dreaded slipped disc under the microscope. Look, if you've ever felt that sudden sharp twinge in your back and instantly panicked, thinking your spine was literally falling apart, you are in exactly the right place. We're going to completely bust the myths surrounding this condition using pure evidence-based science. So let's get to it.
So let me just ask you a quick question to kick things off. What actually slips in a slip disc? You ready for the real medical truth here? Absolutely nothing. Yeah, you heard me right. The whole term, slipped disc, is just totally inaccurate. Your spinal discs are actually anchored firmly to your vertebrae. They don't just slide around in there like a wet bar of soap. So, if nothing is actually slipping, what on earth is causing all that agonizing pain? Well, that's exactly the mystery we're going to solve today.
Here's our roadmap for today. We've got 5 stops. 1. The slipped disc myth. 2. How herniations actually happen. 3. Symptoms and red flags. 4. Evidence-based treatment plans. And finally, number 5, the path to recovery.
All right, let's kick things off with Section 1, the slipped disc myth.
To really dismantle this terrifying idea that your spinal structures can just slide right out of place, we've got to understand what a disc actually is. Think of an intervertebral disc kind of like a jelly donut. You basically have 2 main parts. First up is the nucleus pulposus. That's the soft, really water-rich, jelly-like center. And then wrapping around and protecting that jelly is the annulus fibrosus, which is this tough, fibrous, doughy outer ring. Working together, these discs sit right between your lumbar vertebrae, acting as just absolutely incredible biological shock absorbers. I mean, they handle flexion, extension, rotation, and they literally bear the weight of your entire upper body.
Now, before we look at how this donut can fail, keep this number in your head: 20 to 50. Lumbar disc herniations most commonly strike people between the ages of 20 and 50. I'm pointing this out because, hey, if you're watching this right now and you're suffering from back pain, you really need to know that this is incredibly common in this active age bracket. You are absolutely not alone, and no, your spine is not irreversibly broken.
Moving right along to Section 2, how herniations actually happen.
So, if a disc doesn't slip, how do these amazing shock absorbers end up failing and causing us so much grief? Well, it happens in steps. It's a progression. Step 1 is just simple degeneration and water loss. As we get older, that jelly center just naturally dries out a bit. Then comes Step 2, a disc bulge, where the outer dough kind of stretches out. In Step 3, disc protrusion. The jelly starts pushing really hard against that outer ring. Step 4 is where we hit true herniation, disc extrusion. This is the moment that tough outer ring actually tears, and the soft jelly center escapes the donut. And finally, Step 5 is sequestration, where a piece of that escaped jelly breaks off completely. And the crazy pain you feel? It's often because that escaped jelly is now pressing right up against a nearby spinal nerve root, causing massive chemical inflammation.
Now, there's a critical difference here that trips up so many patients. A disc bulge means the jelly is still fully contained inside that outer layer. It's really just a little swollen. But a true disc herniation is non-contained. The outer wall has been breached, and the material is actually pushing through a tear. Knowing the difference between a contained bulge and a non-contained herniation is super important for understanding what's actually going on in your specific diagnosis.
So where does this structural breach usually go down? Enter the danger zones. The vast majority of these injuries happen at the L4, L5, and L5S1 spinal levels. And why is that? Well, because these are the bottom 2 discs of your lumbar spine sitting right above your sacrum. Just due to gravity and basic human biomechanics, these 2 specific levels take on the absolute highest mechanical load whenever you lift, bend, or even just sit down. They are literally the hardest working shock absorbers in your entire body, which unfortunately makes them the most vulnerable to wear and tear.
Okay, let's shift gears to Section 3, symptoms and red flags.
We need to impartially break down what this mechanical failure actually feels like in the body, mostly because the symptoms can be honestly terrifying if you don't know what's driving them. Here's what you're typically looking at. You'll likely have some standard low back pain, sure, but the real hallmark is often sciatica, that sharp, shooting pain radiating all the way down your buttock and leg. You might also notice some numbness, tingling, or even straight-up muscle weakness in your leg or foot. And here's a fascinating, albeit super painful reality of the mechanics. You'll often feel a sharp spike in pain just from sitting down, coughing, or sneezing. Why? Because those actions dramatically crank up the physical pressure inside your spinal canal, which pushes that herniated jelly even harder against your already irritated nerves.
Now, I want to change my tone for just a second here, because this next part is absolutely critical. While most symptoms are just really uncomfortable, there are certain emergency red flags that you can never, ever ignore. If you suddenly experience a loss of bladder or bowel control, or something called saddle anesthesia, which is basically numbness in the exact areas that would touch a saddle if you were riding a horse, or if you have progressive muscle weakness or severe symptoms in both legs at the exact same time, this points to a very rare condition called cauda equina syndrome. Make no mistake, this is an absolute medical emergency. If you see these signs, you need immediate medical evaluation at an ER to prevent permanent nerve damage.
All right, bringing the optimism back, let's jump into Section 4, Evidence-Based Treatment Plans.
Assuming we are clear of any red flags, let's lean heavily into the good news here. We're going to replace all that fear with actionable science and see how modern medicine actually tackles this issue today. Believe it or not, there is a massive consensus among international clinical heavyweights. We're talking the American Physical Therapy Association, the North American Spine Society, the American College of Physicians, and the WHO. They all unanimously agree on the gold standard of care. Exercise therapy is the absolute first-line treatment. You actually don't need to rush out for an MRI right away unless there are red flags present. And you definitely want to avoid prolonged bed rest. Staying active is absolutely key. Utilizing core stabilization and manual therapy is highly recommended across the board. The old days of a doctor telling you to go lie in bed for 3 weeks? Yeah, those days are completely over.
So what does staying active actually look like in practice? Well, in the physiotherapy world, 2 highly effective, evidence-based approaches really stand out. First, you have the McKenzie method. This uses specific extension exercises designed to centralize the pain, meaning it works to pull that shooting leg pain back up into your lower back, effectively moving the jelly away from the nerve. Core stabilization, on the flip side, involves exercises like planks and abdominal bracing. The goal there is to build a muscular corset that perfectly supports your spine. Both of these methods actively relieve nerve compression and build some pretty incredible long-term resilience. But wait, what about surgery? I know, people hear herniated disc and their brain instantly jumps to going under the knife. But I really want to reassure you that surgery, like a microdiscectomy, is reserved only for progressive neurological deficits, those emergency red flags we just talked about, or cases of severe debilitating pain that completely fail conservative physical therapy over a long period of time. Surgery is a very specific, targeted option for a minority of patients. It is absolutely, positively not the inevitable outcome for everyone.
And that brings us to our final stop, Section 5, the path to recovery.
Let's focus on your prognosis, the actual timeline of healing, and how you can protect your spine moving forward. Because frankly, your own body has incredible healing power. At week 0, yeah, you've got acute pain and crazy high chemical inflammation. It's rough, no sugarcoating it. But by week 6 to 12, with conservative, active treatment, the vast majority of patients see significant, life-changing improvement. But guys, here's the absolute most fascinating part of all this. Over the following months and years, that extruded jelly that broke out of the disc, your body's immune system actually recognizes it as foreign material, attacks it, and shrinks it down. It's a process called spontaneous disc resorption. The herniation literally shrinks on its own. To support all that amazing healing and keep it from happening again, you really just need to adopt a few basic daily habits. Regular exercise and core strengthening will keep that muscular corset nice and tight. Using safe lifting techniques, lifting with your legs, not your lower back, that's just non-negotiable. Taking frequent movement breaks if you're stuck at a desk job all day, and maintaining an ergonomic posture ensures you aren't putting uneven, crushing pressure on those L4 and L5 danger zones we talked about.
I want to leave you with this really powerful concluding quote pulled directly from our clinical sources. Quote, "The majority of patients recover without surgery." Just let that sink in for a second. A herniated disc can cause some incredibly significant, frightening pain, but with early diagnosis, evidence-based physiotherapy, and proper movement, you really can restore your function and get back to your life fully intact.
So, I'll leave you with this slightly provocative thought as we wrap up today's explainer. Really ask yourself, are your daily movement and posture habits actively protecting your spine, or are you unwittingly setting the stage for a herniation? Take what we've learned today about the jelly donut, those danger zones, and the sheer power of core stability, and start applying it to your daily life right now. Keep moving, stay informed, and I'll catch you in the next explainer.